So let me go back to that screen share so you can see. Now, I'd like to share something interesting about the zones, particularly the zones on the anterior part of the thigh. If I uh, flip to the next slide, oops, can I flip back? You'll see that there are various zones on the lower part of the back. So L2, lumbar 2, is the junction, is the demarcation between zones 8 and 9. So often people have back pain, lumbar back pain around L2, so zones 8 above and zone 9 below. And what you will find very often is that the upper thigh gets tense when there's back issues. So this area, zone 8, 9, 10, and 11, can be a very good diagnostic area for back pain, that if you're palpating people's legs and you notice some reaction on one side or the other, it's a very easy diagnostic step to say, oh, are you getting low back pain on this side? So it can be very informative as a diagnostic tool. Okay, I'm going to talk about models of treatment, and then I'm going to give you some case histories. So in my research, I basically talked about the way that Hirata treated when he first started, which is what I call basic HZT. And then Dr. Manaka came along 40 years later and made things a little bit more complicated. In fact, when I went to the International Thermotherapy Association in Japan, one of the first things they said to me was, Manaka made things too complicated. I don't think he did. I think he found a way to be more economical. And then there are more complex or contemporary versions of HZT that we can talk about. But what I'd like you to come away with today is basic HZT, because this is something that is really easy to learn and really easy to teach to people, and therefore can be used to empower our patients to treat themselves at home. So basic HZT, or Hirata zone therapy, is basically a medicalized model using only the zones. So I'll talk about it in more detail. An intermediate HZT, which was more Manaka's thing, integrates channel theory into the zones. And Manaka had all sorts of ideas about how the channels can be used together with the zones. And complex Hirata zone therapy is basically anything contemporary. So using channel pairings, integrating yin-yang theories and polarities such as left, right, upper, lower, front, and back. Now, of course, I can't teach you all these things in this short time, but I think I can teach you how to use basic HZT because it's so easy. And to understand how to apply the zones, we can think about auricular therapy, which was developed in the 1960s by Nogier and then adapted in China with the Chinese version. So there are 3 selection criteria in ear acupuncture. So the first one is using Western medicine as a tool to decide where to treat. So basically, if there's a liver problem on the ear, if there's a liver problem, you treat the liver point. If there's a kidney problem, you treat the kidney point. If there's a heart problem, you treat the heart point. So for basic Hirata zone therapy, this is the same criteria. For liver problems, you treat the liver zone. For kidney problems, you treat the kidney zone. And for heart problems, you do the same. So very, very easy. So if someone comes to you and says, oh, I've got problems with urination, or I've got bladder problems, you can choose to use the bladder zone, or you can choose to use, if they've got nephritis, you can choose to use the kidney zone. So a very simple selection criterion. Now, the next one is coming from traditional East Asian medicine theory. So basically, We know that in acupuncture theory, different organs affect different tissues. So, for example, the liver opens into the eyes, or the kidneys affect the memory, or heart issues can affect sweating, or lung issues too. So you have to decide which is behind it. So um, you can use team theory to inform your choice of zones. And I'll give you an example of that in a few minutes of when I treated someone with eye problems. Now, the last thing in ear acupuncture is the location. Very often in ear acupuncture, people say, oh, well, you've got problems in the lumbar area, so I'm going to do the lumbar spine area. And so we can think exactly the same way for the zones, which is that if there is a pain in a certain zone, so for example, I talked about lumbar pain just above and below L2, so zones 8 and 9, then you can look at zones 8 and 9 in all the different regions and see whether there are reactions. And often as not, you will find some reactions in those zones. So you can just treat the same zone in a different region. So location is a very useful idea. So for lumbar problems, treat the zones that traverse the lumbar area. For shoulder problems, treat the zones that traverse the shoulder area. So 3 selection criteria: Western medicine thinking, so medical thinking, traditional East Asian medicine thinking, and location. Those are your 3 ways to select the zones. Now I'm going to give you 3 case studies. So the first one was in Kuala Lumpur. Guy, 32 years old, with a persistent cough and occasional lower backache. He was generally healthy and robust, and he developed what he called a mystery intermittent cough that he was unable to shake. So generally, he was quite healthy and robust. And on questioning, the timing of his cough suggested that it was actually nothing mysterious. It was to do with what we call the haze in Kuala Lumpur, which is a yearly cycle of air pollution. So, right. He also developed some intermittent lumbar pain. So Hirata's prescriptions for cough typically focus on zone 1, the bronchi. And according to the location of the back pain, the affected zones were 9 and 10. So when we palpated around the leg, there was marked tension at zones 9 and 10, basically on the stomach channel above the knee, and a few slightly rough patches on his chest at zones 1 and 2, which are around here. So we tapped on those with Ontake, on the deficient areas on his chest and upper arm. We just tapped with Ontake until the skin felt warmer and more even. And then we worked on his thighs with the side of the bamboo, just pressing and rolling and knocking until that tension on the anterior thigh was relieved. And after he turned over, we tapped on the upper back, identifying and treating more dry and rough areas. So it didn't take long, maybe about 10 or 15 minutes, and no other treatment was given. So following the session, he reported immediately that the stiffness at the back of his legs and his knee pain, which he hadn't disclosed, felt much better. And this maintained. And the cough also cleared for a few days, but when the pollution got worse at the end of the week, it came back. So we couldn't help with the pollution. The next case is a female, a woman around 30 years old who had lumbar and buttock pain and abdominal distension. So she'd been coming for back pain for a few weeks with acupuncture, and she'd been getting better, but she'd had a long flight home, and she had a relapse coming home from a conference. So according to the location of the pain, the zones were 9, 10, and 11 on her back. So above L2, below L2, and over the sacrum. And just as a quick mnemonic, zones 10 and 11 go over the sacrum. So if you misspell the number 11 in your mind, you can say, to treat the sacrum, choose zones 10 and 11. So 11 and sacrum is your mnemonic. So 10 and 11 is sacrum, 8 and 9 is lumbar. So yeah, those were the locations. And then her abdominal distension relates to spleen and stomach, according to team theory. So when I looked at her thigh, once again, marked tension at 10 and 11. Bamboo was applied, pressing and rolling on the right. And after the muscles released, which didn't take long, a couple of minutes, her left leg also felt much more relaxed. So we did the same thing, but just for a shorter time, just for half a minute. After this, we got her to walk around and she said, oh, the pain was much reduced. So then we worked locally on the back of, then we worked on the back of both hands. So zones 10 and 11 on the hands. And after testing once more, the pain was completely gone. And then we got her to lie face up in supine position. And we worked on zones 6 to 10 on the abdomen from the midline out towards the lateral aspects. So those whole horizontal zones. And then we finished with local rolling on the back, just working where the pain was as well. By then she was very relaxed, and we finished just with a very light Toihari style root treatment. So you can see this case is more to do with location of pain. And finally, a male, 32 years old, sudden onset of redness and itchiness in his right eye, which was beginning to close up. So according to team theory, the liver opens into the eyes. So we did zone 4, which is the liver zone, on the head, the arm, the back, and the legs, simply tapping each zone for about 1 minute. And on the limbs, we just did the right side only. On the head and the back, we did both sides. So the eye infection reduced in intensity within minutes, and it had completely cleared up within 2 hours. So just tapping the liver zone with Ontake, no other treatment was given. I'm not going to teach you very much about intermediate Hirata zone therapy, but I'll just say that I'll say a few interesting things about it. Dr. Manaka came 40 years later, after he came into this work 40 years after Hirata's death. Hirata had already talked about meridian lines, but because he was slightly medicalized, he didn't want to call them meridians. Instead, he called them flexion lines and extension lines. And he started to use the meridian system, which is basically the meridians by another name, in his own way. But what Dr. Manaka felt was that there's something lacking from traditional acupuncture theory, because all the meridians in the body, apart from the daimai, are longitudinal. They run along the arms, and they run along the legs. So they all go top to bottom, bottom to top, and only one of them goes horizontally. So he felt that if you draw, and you'll see from this illustration here, if you draw the meridians on the arm, and then you draw the horizontal zones on the arm, what you've got is a three-dimensional model of the body. It's like a very primitive computer rendering of an arm. So he thought that integrating these two systems together gave you a much more three-dimensional way of viewing pathology in the body, and of palpating, and of finding reactions. And he said that the most important thing to treat was not the whole zone, but where the relevant meridians cross that zone. So in other words, just look for that bit where the meridian is crossing over into the zone that you want to treat. Now, we interviewed a practitioner in Japan called Yokoyama Sensei, who has written his own book on hot needle therapy and Hirata zones. And he says that he believes that the whole zone system is an extension of the horizontal quality of daimai. So the daimai in traditional thinking goes around the belt on the torso, and its influence can be seen on the arm and on the leg in the horizontal banding of the zones. So I think that's a very interesting observation. Um, I won't talk about any cases or treatment because otherwise you'll have steam coming out of your ears. But uh, we'll go to the next slide, and I'll talk a little bit about contemporary uh, HZT. Um, for those of you who read my first book, you will have seen that I used Ontake for pain relief using holographic models developed by Dr. Richard Tan. Um, and Dr. Tan used a lot of channel pairings. So, what I found in my own work is that you could swap out a bit like the motherboard on a computer. You can take out a component on a computer and put in a different piece of hardware. If you take out the model, the holographic models from Dr. Tan, and you swap in the holographic models from Hirata, then you've got a new system for treating, which uses channel pairings, just like Dr. Tan does, uh, but has all kinds of new possibilities because of this horizontal modeling. Um, so I've done a lot of work using Dr. Tan's channel pairings with the horizontal mappings of Hirata. But basically, in complex or contemporary Hirata zone therapy, anything goes. So you can integrate it with what you already know about acupuncture, or you already know about shiatsu, or your own healing styles. So there are people who've been trying to integrate this kind of thinking with Sa'am acupuncture, for example. So anything goes, basically. And the other thing that I did is that I integrated Dr. Manika's meridian frequencies, tapping with a metronome. So these are things that can be very useful. And so I would say complex HZT, your imagination is the limit. It doesn't have to be what I thought of, it can be what you think of as well. Now, what's the value of all this in the clinic? Um, I think there are various things that we can say that this is useful for. It's a very good adjunctive treatment. So, in other words, you do what you like to do, you treat in the way that you normally treat, and then you add some Hirata zone therapy at the end or in the middle of your treatment in the way that I was describing with the 32-year-old woman with back pain, where I did Toyahari as part of the workflow, but also I did Hirata zone therapy. So it's an adjunctive treatment. It can be an additional treatment. Or, as in the case of the guy with eye problems, it's a treatment in itself. You don't need to do anything else. You just treat alone using the zones. But for me, the most exciting thing about Hirata zone therapy is that it empowers patients to continue their treatment at home, because it is actually a very simple thing to teach people to use bamboo. It doesn't take long to model it, and you'll see. I think in my last talk for JCM Balance, I showed how to load and light bamboo, and the talk didn't take long. It doesn't take long to show someone how to fill up a bamboo with moxa, set fire to it, and to tap it on their arm. So you can empower your patients to continue their work at home, which is going to create momentum, because you can say to them, look, I just want you to do the kidney zone on your arm and on your leg every day for the next week, and then come back to me next week and let's see how things go. Or I want you to do this on your daughter every day for the next 2 weeks. Just treat the lung zone and the bronchi zone because of your daughter's asthma. So you can give these kind of treatments to your patients. So you can give them bamboo, you can give them moxa, and you can create this new empowering method for them to continue work at home without having to know anything about meridians, without them having to know anything about yin yang theory. You can just say, look, I just want you to tap here every day. So it's a very empowering thing to do. Now, some of you have asked me what the book cover is about. Um, basically, it's referring to Hirata's work on posture. He did a lot of work on posture where he said that stretching his flexion and extension lines, in other words, the meridians, he developed all these postures for strengthening the organ function through posture. So we modeled that for our book cover. Um, it's 90 years since his first uh, publication. Um, and as I've been working on this quest, this mission that Stephen kind of triggered, uh, I've discovered this lost art of dermatome moxibustion. And personally, I've become infected by his idealism, this idea that we can give patients something to do at home that is easy and simple. Um, I've thought very much about authenticity, is what I'm practicing now authentically Hirata? And I have to say, it's not. It's something that has been repurposed for contemporary practice because, of course, we don't want to use a piece of metal filled with burning alcohol. Instead, we can use ontake. And there are all kinds of considerations that apply to us in the 21st century that didn't apply to him 90 years ago. But I think for me, the most exciting aspect of Hirata's own therapy is the sense of empowerment, the sense that he wanted, that this Shinryoki was distributed free with his first book, and it was a runaway bestseller. It was reprinted many, many times during the first month. So it became like a big hit in Japan, people tapping at home with the Shinryoki. And I think only history and his death and politics and the waves of fashions really, and the fact that we couldn't get these things in the West, I think those things have stopped us from finding this knowledge. So I think it's a really amazing therapy, and thank you very much for listening.